Hello everyone, welcome back to my channel. So today we are going to continue our topic, that is motility disorders. First we already studied about the achalasia. Now we'll study about the diffuse esophageal spasm. Diffuse esophageal spasm basically indicates when the normal peristaltic movement suddenly convert into no peristaltic movement, and no peristaltic movement which results in the high amplitude and which causes spasm in the esophagus and which results in the contraction. Like this, spasm occurs in the esophagus and a sudden contraction occurs. The symptoms are chest pain, which resembles angina. We already studied about in the previous lectures that we can distinguish various chest pains from by ECG. Second symptom is transient dysphagia, which resolves after some time. We can diagnose by barium swallow, and it resembles corkscrew appearance. In the previous, achalasia resembles board beak appearance. In this, it resembles corkscrew appearance. We can diagnose manometry also, which indicates pressure like 400 to 500 millimeter of Hg. Third is nutcracker's esophagus, in which the forceful peristaltic contraction occur. In the diffuse esophageal spasm, it is no peristaltic movement. In this, forceful occurs, which results in episodic chest pain, dysphagia. We can treat by calcium channel blockers, nitrates, pneumatic dilation, or surgical myotomy. We studied about the achalasia, diffuse esophageal spasm, and nutcracker esophagus. Now, fourth is pharyngeal pouch, which is also known as zenker's diverticulum. In zenker's diverticulum, three outpouching occurs in the esophagus, in which the food collects in these outpouching, which results in the regurgitation and aspiration, and which can results in halitosis, which is foul smell in the mouth. But it is not as much. In esophageal diverticulum, most common is zenker's diverticulum. So the symptoms are halitosis, dysphagia, regurgitation, and we can feel mass in the neck. We can also diagnose by barium swallow, but endoscopy is contraindicated because it can rupture the esophagus, which results in the peritonitis, and mediastinitis, which results in the sudden death of the patient. Surgery is the treatment of choice, and surgery can be myotomy or resection. The secondary causes of esophageal motility can be Crest syndrome. In Crest syndrome, sudden continuous inflammation occur, then fibrosis occur, then aperistaltic movement occurs. Second is multiple sclerosis and stricture formation. Stricture is narrowing, and which also alters the motility. So that is for the video. This is esophageal motility disorders. Thank you for listening to my channel, and please subscribe to my channel. Thank you.